States are seeking sweeping flight bans to stop the Omicron spread and for it not to enter India. Maharashtra is seeking grounding of all flights from at-risk nations that have been identified by the centre. It's also issued strict guidelines for travellers from countries that have been identified as hotspots, which include a mandatory 7-day institutional quarantine, RT-PCR tests on the 2nd, 4th and 7th day from arrival in India, hospitalization, of course, of all positive flyers, a 7-day home quarantine for those who've tested negative. Passengers from other countries will have to undergo compulsory RT-PCR tests at the airport, while all positive flyers will be hospitalized. Others will have to undergo a 14-day home quarantine. The Delhi government has sought a ban on all international flights. It's also implemented guidelines issued by the centre, including a negative RT-PCR report before departure from the at-risk country and a second RT-PCR test on arrival in India. Genome sequencing for all positive tests must be done, a mandatory 7-day quarantine for all flyers and a third test for symptoms after 7 days. The quarantine in the case of Delhi will not be institutional.
I'm at the Mumbai airport right now, and this is where the entire precautions that have been put in by the Mumbai International Airport can be really seen, wherein people who are coming in from the high-risk countries like UK, like New Zealand, all these people are being segregated. They are being from the people who are traveling from non-risk countries. Right here, for the people who are traveling from high-risk countries, there are added precautions, like they have been asked to take care, not to really mingle with others. Also, heavy testing. There are more than 50 booths that have been put up where RT-PCR tests are being done. Apart from that, there's a waiting lounge for people to wait in, where if the testing really takes a while, they'll be asked to wait. Also, for people who have connecting flights, if they are in transit, then for them also antigen tests have been put in place. So, heavy testing right here at the airport itself is being done to make sure that the spread of Omicron strain that has really now been the issue of concern right now does not really spread further. With cameraman Vijay Desai in Mumbai, Vidya for India Today.
सरकार ने जो 11 एट रिस्क कंट्रीज हैं वहां से आने वाले यात्रियों के लिए गाइडलाइन जारी की है। आप देख सकते हैं इस वक्त हम लोग एयरपोर्ट के अराइवल पे हैं, इंटरनेशनल एयरपोर्ट के अराइवल पर दिल्ली में मौजूद हैं और यहां से जो भी 11 देशों जो एट रिस्क 11 देश हैं वहां से जो यात्री आए हैं उनको अंदर रोका गया है। RT-PCR टेस्ट की पूरी व्यवस्था अंदर की गई है। जो जानकारी मिली है उसके मुताबिक 4 देशों से जो एट रिस्क 11 देशों में 4 देशों से 1013 यात्री यहां पहुंचे हैं, जिनमें से कुछ ने रैपिड PCR टेस्ट कराया जबकि RT-PCR कुछ यात्रियों ने कराया है। और जो एयरपोर्ट प्रशासन का कहना है जो तमाम जो सुविधा है, जो पूरा सिस्टम है उसको बनाया गया है। कोशिश है कि किसी भी तरीके से ओमिक्रॉन को फैलने से रोका जाए। इसके अलावा 11 देशों से अलग अगर कोई दूसरे देश से यात्री आता है तो उसमें भी टेस्टिंग की व्यवस्था है, लेकिन वहां पर ये देखा जा रहा है कि क्या उसमें कोई इस तरीके के सिम्टम्स हैं या नहीं है। कैमरामैन परमिंदर शर्मा के साथ हिमांशु मिश्रा, दिल्ली।
Now, with more and more countries reporting cases of the COVID variant Omicron, the lower house of the parliament, Lok Sabha, is likely to discuss this crucial issue. This mutated variant of COVID and its spread will be discussed in the Lok Sabha under Rule number 193. The discussion under Rule 193 does not involve a formal motion before the House. It will essentially be a statement, and it's likely that Union Health Minister Mansukh Mandavia will be briefing Parliament on the mutated variant and the measures that have been taken by the government to prevent its transmission. This discussion is expected to happen at around 2 this afternoon in the Lok Sabha. More than 19 countries have reported cases of Omicron so far. No cases so far have been reported in India.
कि ओमिक्रॉन वेरिएंट अभी दुनिया के 14 कंट्री में पाया गया है और यहाँ उसका अभ्यास हो रहा है। इंडिया में अभी उसका कोई केस रिपोर्ट नहीं हुआ है, लेकिन दुनिया में जिस तरह से इस वायरस के संदर्भ में हमें सूचना मिली है उसको देखते हुए एक एडवाइजरी भी डिक्लेयर की गई है। पोर्ट पर हमने भी देखरेख रखना शुरू कर दिया है। कोई भी ऐसे संदिग्ध केस है तो उसको तुरंत ही चेक करके उसको जेनोमिक सीक्वेंसेस भी करा रहे हैं। कोविड क्राइसिस के दरमियान हमने बहुत कुछ सीखा है। आज हमारे पास बहुत कुछ संसाधन भी अवेलेबल है, सारी लेबोरेटरी भी अवेलेबल है। कोई भी कैसी भी स्थिति को हम देख सकते हैं।
Now, there are a lot of questions being asked of the Omicron variant, a lot of fake news also that's doing the rounds. We're trying to put the record straight here on the information that we have about Omicron. Are symptoms of the Omicron variant and other variants different? The answer is yes. So then what are the new symptoms? What are the symptoms you'll see if you have the Omicron variant, if you're a carrier? Tiredness, scratchy throat, mild muscle ache and dry cough are the symptoms that experts have confirmed. Then how is it different from previous symptoms? Well, the symptoms like loss of taste, loss of smell, the cough symptoms, all of that hasn't been seen yet in the Omicron variant in those who've tested positive for this variant. So how can you test if you have this variant or not? Does an RT-PCR test do it? The World Health Organization has said yes, very much. The testing formula is the same. Does it cause more severe disease? At this point, there's no clarity on that. The World Health Organization is saying that studies are still on. We don't know the level of severity of the Omicron variant. Does it cause more infections? Is it more transmissible? Again, the World Health Organization says that at this point we cannot confirm or deny. It is still unclear. Studies are on to identify all the specifics and the details about the Omicron variant. Let's now listen in to exactly what the WHO chief has had to say on this new variant and its spread across the world.
We shouldn't need another wake-up call. We should all be wide awake to the threat of this virus. But Omicron's very emergence is another reminder that although many of us might think we're done with COVID-19, it's not done with us. We're living through a cycle of panic and neglect. Hard-won gains could vanish in an instant. Our most immediate task, therefore, is to end this pandemic.